Hello and welcome to World Massage Conference. I'm Eric Brown and I'll be your host today for today's presentation with Boris Prilutsky on the topic of massage for whiplash in sports and car-related injuries. If you're joining us for the live presentation, remember to log into the chat room located just to the right side of the broadcast screen. Log in with your Facebook or Twitter ID. Our presenter will be in the chat room for the live event to answer as many of your questions as possible. Before we begin, we'd like to thank our sponsors. Thanks to Massage Envy. Like you, Massage Envy is out to make a positive difference in people's lives. Visit MassageEnvyCareers.com or like Massage Envy Careers on Facebook to learn more. It could be the best career move you've ever made. And thank you to our education partner. Associated Bodywork and Massage Professionals provides an extensive array of member benefits and exceptional liability insurance. Visit www.abmp.com to discover why over 80,000 massage and bodywork professionals have chosen ABMP as their professional association. And thanks to our daily sponsors, Massage and Bodywork Magazine, Massage Today, BioFreeze, and Bon Vital, as well as Massage Warehouse. And now let me introduce you to Boris Prilutsky. Boris has been teaching and practicing medical and sports massage for over 40 years. He's the founder of the Southern California Health Institute, School of Massage, Physical Therapy Aid, and Chiropractor Assistance Program in Los Angeles. He graduated with the degree in physical education in the Ukraine, completed postgraduate physical rehabilitation study in Leningrad, and graduated from medical college in Israel with a major in chiropractic medicine. He's worked with Olympic teams from the former Soviet Union for 20 years. Boris has trained thousands of therapists worldwide and continues to treat patients in California. Today we're going to join this Russian medical massage expert in a workshop on the theme of massage for whiplash in sports and car-related injuries. In this special video presentation, you'll get an overview of the treatment of whiplash injuries, both sports injuries and motor vehicle accidents. Boris will lead you step by step through a comprehensive approach to treatment that addresses both the muscular and fascial elements, trigger points, and tissue edema. Let's join Boris in class now as he starts his whiplash treatment demonstration.
Basically, medical massage containing strategically, it starts from approximately 7 minutes with the introductory. Introductory is necessary two main reasons in inhibitory regime. It's called...
So she can breathe out.
Oh, I tucked it under so she...
Okay, I was just going to use a pillowcase instead.
Oh, it's okay.
Oh, pillowcase could be better. Yeah, you will be able to breathe.
You just have to pull it from there.
Yeah, absolutely.
There you go.
Welcome to oxygen.
We need feedback, so you have to be able to breathe. That's important.
Yeah.
Good one.
Yeah. Guys, what is it, inhibitory regime? Usually inhibition, but it's called inhibitory regime because inhibit sympathetic activities. But bottom line idea to perform massage in inhibitory regime introductory is to suppress activity of sympathetic nervous system, and this is the only reason why scientists call this inhibitory regime. It's pretty light touch, 7, 8 to 10 minutes, light touch, mainly kneading, could be a fluoride, doesn't matter. We bringing the receptors to the level of the adaptation, and this causing drop in suppressing sympathetic activities, causing drop in muscular tension, awakening vasodilation, more blood supply coming. But mainly this inhibitory regime, not mainly, I'm sorry, working in inhibitory regime, it's not mainly, but also we're reducing local lymphedema. Very important, guys. Even in the beginning, if you not see lymphedema, it's there. If this was severe sprain strain, excessive amount of extracellular fluid, it's there. Yeah, and this pumping you will see I will do on chest pumping also after this to support the drainage also. It's 7-8 minutes. In a second I will take lubrication, it will go smooth. And then, guys, Dr. Duclair, Elizabeth Duclair, in 1929, this is how far roots of medical massage going. She propose fascia visualization connective tissue massage with third and fourth fingers. You're pulling until day of today, guys. In Austria, you're pulling to the different direction. Fascia is connective tissue. Fibers cannot connect, although this is one alliance, muscles and fascia, one alliance. Yeah, but difference between fascia and muscles, that muscles fibers have potentials to constrict, fascia not. And fascia can accumulate this tension when muscles prolong. First, dysfunctions start. Myofascial dysfunctions always, if there is no autoimmune disease that will affect connective tissue, always myofascial dysfunctions start of higher tension with the muscles. Vessels with the muscles also constricting, it's decreasing blood supply. Fascia is any connective tissue, tendon, ligaments receiving blood, so they don't have this avascular structure, they don't have blood vessels. They're receiving blood supply through release of these vessels within muscles. And when muscles accumulated tension, high resting tone, vessels constricting, it's decreasing blood supply, and due to metabolic disturbances, little by little fascia start accumulating tension. And what fascia does, actually, physically, it's surrounding muscles. And here is the, how you call it, 22 kH. It's 22 kH. Now you cannot achieve sustainable resting tone with muscles because tense fascia is surrounding, and this is constant irritator to this. You see? Therefore, to release this fascia is extremely important. We're doing this. Duclair, I do this 43 years until I didn't develop method based in the frame of her principles of her. You're doing like this, you're grabbing, and this is the only, if muscles we can kneading, we will awake muscular relaxation. Fascia, because this is like a reversible deformation, you have to pull to the different sides. You have to, like this, grab hold of skin, and then pretty fast movement have to be. Pretty fast. This is the connective tissue originally. Second layer, Professor Chernik, Russian physician, this is superficial fascia we're addressing. Yeah. Second layer, we just like this. You see, with this energy shock, releasing this wrinkles. It's like a wrinkles, releasing. This is like this. Now, you will see right now my method, Prilutsky's method, yeah. Like I stated, ooh. Yeah, it's...
I have a quick question, if you don't mind.
Yes. Please, go ahead.
When you just demonstrated the next layer of...
second layer of fascia.
Second layer.
We have three. Number 3 we cannot reach. In part, necessary, but doesn't matter. Yes.
Where you just showed just this very quick, you could, that is fascia release? I mean,
second layer. This is Duclair proposed first layer, and it's working great. You're grabbing. You see what I'm doing, for example, this is epidemical center of tension of fascia here. And this we can detect, we're detecting actually limitation of motion, fascia is stopping you, yeah? Means fascia there, wrinkles, yeah? What I'm doing, I'm putting, if this center, I'm putting my 2 fingers from center and out, and I'm pulling, and I'm straightening this out. It's actually physically, mechanically, I'm grabbing and I'm releasing. It's the great news that fascia release, you see, this is why I'm moving. If this is center, I'm moving like grab and go, grab and go, grab, hold and go. I already developed the skills I can do pretty fast. You try to grab, to flex, 3rd and 4th fingers, you holding, fold of skin, right now fascia in your hands, and you just move pretty fast. But to do always, if you want to successfully release tension with the fascia, remember this mechanical factor. You have to straight. It's like this, not otherwise. Yeah.
Is it a lot of pressure, or?
No. Look, sometimes pressure you're not applying. Fascia could be significant tense, and therefore to grab the fold you will need a little bit more effort. As much effort to have this fold of skin. You can see, and then move, and then move it. Yeah. The Chernik method, this is like this. Second, right now, look what a force, energy. This energy enough to release, to address second layer of fascia. And also you have to move. I will do on this side. To move around this circle, different direction. You have to. You're creating force of different directions. Yeah. Okay. Now, if I will be able to open it. Somebody have experience? Okay, guys, this is the inhibitor regime. You see, lubrication needed. Lubrication needed, maybe a little bit less than I'm doing. Yeah. No, I pressed and it's come out a lot. It's a good idea, these tubes. Yeah, mainly kneadings, you can hands after hands, all this, and kneadings, 8 minutes, very light touch, very gradually increasing, minimum increasing. Usually we're increasing pressure gradually, and in inhibitory regime, just very light. 7-8 minutes, we reaching adaptation of these mechanoreceptors. And why we're doing it, guys? What is the importance? To decrease, it's so painful. Right now, if I will start, we have to increase threshold, and this helping to increase threshold, to go deeper and deeper. This is the intensive therapy idea. We don't have too much time. I never had too much time. You also with your clients. They have to get rid of this suffering as soon as possible. Therefore, understanding, when one understands importance of this inhibitory, the 7-8 minute slide, a lot of people all have to be understood. Then you're managing well intensive therapy, what I call. Every second of touch understood, and we cannot waste time. We just cannot.
What if you're only given 15 minutes per client?
Stress management, spend on stress. Orthopedic massage actually you can do, but on which region? On full body?
No, just on
neck and upper back. Then focus on stress management. It's possible orthopedic massage to do. It will be improvised, but why 15 minutes?
Because that's what the new chiropractor.
Ah, then look, and look for other chiropractors. No, I mean it. If you don't look, if you just want you to prepare to relax muscles for more successful 15 minutes, I agree, inhibitor regime will do the magic. But you need more. You have to eliminate. You have to spend on connective tissue. Then this 15 minutes spent on inhibitor regime. Yeah, it's actually I'm too fast reacting. Yeah, if chiropractor wants you to prepare particular region as a pre-adjustment, okay. Do this. Don't do this pressure, because you will apply a painful spot. Vigorous pressure and sudden muscles will go. This is reflex. It's not voluntarily. Reflex muscles, and then he will do adjustments, and the patient will feel worse. You just in inhibitor regime, explain to him what is inhibitor regime. Please visit my website. There is articles that explaining physiological effect as it was proposed by Professor Sherbak. Yeah, explain, give him, tell him, listen, there's a science behind this. Yeah. Yeah, really. No. If you're not open mind, listen, I feel sorry for you. Little by little, start looking for somebody else. But if he want to work with you, yeah, as a preparation, 15 minutes is good. Inhibitor regime. Don't try trigger points and just in preparation and explain to clients. Listen, it's inhibitor regime. Have to be done light to prepare to successful adjustment.
You want more?
To eliminate. This is he have to manage. He have to understand the importance of my facial mobilization. See, soft tissue mobilization by hands. This is therapy by means of massage. Yeah, and if you don't understand that subluxation is a result of my facial dysfunction mainly, then we're difficult. Then supposedly I have to do connective tissue massage. Guys, you saw with connective tissue massage we're doing fascia mobilization with no lubrication. But you saw what I used to hold. Yeah, now look. Fold there. And you will see in few seconds already hyperemia. How effective. You see it's blood rushing. This, yeah. I swear. When I took in my hands 4 years ago these silicone jars, I knew. Somehow it was in there. I knew something. Look at the color. And
that feels.
oh, it's you. Believe me, she will report after the outcome. You know, at the time of the treatment, it feels good. And look how I do, and we have to little bit. I grab and I stop, and in 10, 15, 20, 30 seconds, I will add it a little bit. But look, even light.
Yeah, can I ask a question? Versus this one versus the fire cupping?
No, fire will not work. Not only. Fire cupping will not work. You will come to my website, you will see. I even on my DVD, teaching 20 years ago, less a little bit, I teaching fire cupping because it was part of conventional medicine in Soviet Russia. From childhood we knew, Mom, you start coughing, bronchitis, this shit is cupping with fire. Here, and I started doing it here in America. People afraid. America, you explain what you do, fire. Yeah, you know, on YouTube I demonstrating a lot. This is free lessons also on my website. You will find, yeah. And this was bothering me, and sometimes I didn't want to give up even sometime to do it. Suddenly this company, they advertise it as a substitute to fire. I didn't believe, but I said, well, maybe this is powerful enough. When I grab it, I understand it's much more and bigger. Now, why glasses not? Periosteal massage, look, I'm putting against spinal processes.
Oh, yeah.
You can do, oh, this glass is too harsh, it will traumatize. And periosteal massage is extremely important. You know, the periosteal trigger points that you see mainly when you move, terrible pain producing, this is periosteal. 1, 2, 3. You can see in the redness, it's already red. What is the trigger points? It's pinpoint localization of pain due to what morphology of these trigger points. Blood supply demand much higher than availability. You compress ischemically, awakening vasodilations, and here you compromise blood supply, receiving no pain, because and you can see this is what amazed me, But guys, it took me 3 years, seriously. I didn't want to publish nothing. I knew I developed on people, they knew that I'm practicing on them. This is very amazing. And look, I'm doing many years, more than 40 years, connective tissue mobilization. Must do. If you will not release tension within fascia, impossible to sustain results. One of simple examples, the fascia surrounding muscles in holding. And already this 22 kg. You cannot sustain normal tonus with muscles, but bottom line, you need normal function of fascia and muscles. It's impossible. I know how to do it. I declare method, and I know very good. Now, if somebody beginner don't have this kind of experience like utilization of these cups make us all experts, guys. The same level, And you could see it. This is not what, you know how long I have to work with fingers to get this hyperemia? Forever. Yeah, this is something amazing in stress management incorporate. Even when we released here, by the way, I could hear tuk tuk, it's even adhesions was. Yeah, we released. This maybe because of this middle portion of trapezius can restrict movement of neck. Yeah. Please.
a lot of times, like when people do cupping, they'll have like a kind of not a bad reaction, but it gets like black and blue. Does that give the same effect as that?
No, look, it can give little bruise if you will hit adhesions. These artificial glutes of tissue due to chronic inflammatory condition, low-grade inflammatory. Yeah, it will be bruised. And in this case, they have to know. But to eliminate by connective tissue massage, to eliminate these adhesions, it's kind of, you need expertise. With hands, we also used to do, we used to define this, you grab with no lubrication, this is what I'm using. Yeah, you grab, twist, and you take and you tearing. Yeah, you have no choice, guys. Adhesions have to be eliminated. In fibromyalgia cases, you cannot achieve results, and doctor can tell what they want. This is fibromyositis. This is what fibromyalgia is. Means low-grade inflammatory condition with the muscles and fascia. And adhesions, it's with years, it's full-body adhesions. You have to eliminate them all by hands. You will not progress. You will not progress in any myofascial cases, chronic cases, but fibromyalgia, it's special. Could be bruising, you have to prepare your clients. In most cases you will not see, you saw me pretty intensive, yeah. Although, talking on bruising, if you will leave this for 15 minutes, like this, it will be bruised more than Chinese cupping. Mark will stay.
So much.
And this is very good, guys. This is very therapeutic effort. Look, I don't know if you heard about PRP, platelets rich plasma, regenerative therapy. What doctors doing, taking your own blood in centrifuge, they separating plasma rich with plates, and they injecting. And this regenerating even when sclerotic forms. Why and how? Look, it can bruise if you a little bit will press stronger. It can bruise to the bone. It's extracting this bruise. It's a hematoma. There's no trauma. It's sucking out blood. Yeah. It will stay probably if you will keep it 15 minutes. It will stay with you probably a few week maybe. Yeah. How this hematoma, not traumatic hematoma, it's kind of extracting from capillaries blood. How this hematoma can be dissolved? Only increased blood supply. The killer cells have to come and to take. And this hematoma triggering so much increasing blood supply. Woo, we're triggering something very good. Now, in case, usually on projections of joints, we used to do this to leave. This you can do with fire and leave it. Don't move. And leave it on spot. You're bruising, it's significant, very significant bruising. Pain after this will be not so significant, but bruise, it's not a contusion. Bruise, scary a little bit.
It's yucky, but it doesn't really hurt a whole lot.
No.
Okay.
People out, so
No.
clients be like, I don't really want that.
Yeah.
Oh, no, listen, let them sign that will be bruised. No, you don't force. Let them. And I'll tell you something else. You know, 5 or 6 years I made a lot of money. You know what? These movie stars used to come to me that I will mark them to live decoration. Mark. No, I'm not laughing. 5 or 6 years ago, they used to refer each other, and I used to play. And all these Chinese places who utilized, they were very busy. Everyone wanted to be like movie star. One appeared with this. Yeah. Welcome to America. Celebrity mentality. Okay, guys, when this whiplash affecting in really pretty forcible subscapular structures, all of them, they first who go into defense. Very important, extremely important to do scapular manipulation. Very. It's have to be done after all inhibitory regime introductory massage, connective tissue massage. In this case, I used my silicone jars, discovery. Then you know what, I will ask you a little bit, few inches to move. Yeah, this is good. This have to be out. Yeah. Then what you're doing, you're fixing with front thigh, you're fixing with elbow, the arm, and you placing hand under on projection of joint. Yeah, and then you see, don't block scapula. You have to little bit. It's pretty mobile. Place your finger here on the border, and then slowly. Yeah, you have to. Now start from minimum range of motion, little bit. It's under stretching. You have to do little bit massage with thumb under. Little by little, and again, there is a lot of, it is stretching actually, antagonizer, but this is the act of stretching actually. 5, 6, 7 times. Then you placing hand on the top of the shoulder, and you start pushing back and forward. You have fun, and a little bit to me because I need little place to push it forward. You see, you're pushing forward. And then, of course, here you're not resisting and back. You can do this with both hands, even. Yeah. On this, you're spending 5 to 7 minutes on this manipulation. And then, guys, if this is possible, you know, this is judgments and responsibilities yours. You will see when threshold of pain increase and you feel you can do. Of course, if you will ask your client to put like this hand, and they will start screaming, ah, and they will go to protective, take it out. It will come time. Will come time you will do it. But if all going smooth, and let's say all inhibitor regime, connective tissue massage all went very well, and you increase threshold of pain much. You just placing after scapular manipulation, you fold like this. You're placing under. Yeah, relax. You see, yeah, and here, in here, little by little traction. But really, look at me. I'm bending my knees, guys, and this is what slowly. Here I got this traction between me and her, and how I'm increasing by bending knees. I'm not pulling. You don't want to strain. Absolutely, all sensitive. Better, you know, my professor Denver, rest in peace, he used to say like this: in physical medicine, you can allow yourself to do much less, but you cannot allow to yourself to do a little bit more. And this is true. Yeah. Therefore, don't rush. Do intensive. Don't spare too much your clients. Yeah. Yeah. But not aggressive pushing and not aggressive sudden. Yeah. Now, sometimes when big men, it's need a little bit kind of, and threshold doesn't matter, but size play a role. But condition threshold already of pain increase. It's less sensitive. You just like this. You placing under knee, yeah, and here I go down. Yeah, it's much more force capability to increase the power of traction. Yeah.
Why are you focusing so much on self after Whiplash?
It's not so much, ma'am. As I explained, did you sit in class when I explained the nature of strain? Yeah. This is what I explained. A lot of force coming on this, and not too much. Actually, if this will be more painful, more stress, of course I will spend a little bit extra time. It's must. This is a matter of fact that scapular and subscapular structure, when suddenly sprained, whiplash, going in the garden, it's impossible to get rid of pain and to restore functional activities if not to address this like this. They blocking it, and this is not too much. Absolutely, it's much more time we have to spend in real treatment room and with real injury patients. This is not too much time.
Your normal treatment time for something like this?
45 minutes.
45
Yeah.
45.
I'll tell you why. Used to be, I was trained 28 minutes, framed 20 in. Yeah. With no, it's possible. It's possible. But look, it's possible. But nowadays, you must incorporate stress management. You must. In these cases of whiplash, sudden fear, and etc., guys, today we're so much overstressed, impossible to sustain results. You see, to make different, if somebody have pain, limitation of motion, you can do in one treatment. Bravo. What does it mean? It means the therapy working for person. Is this enough to sustain results? No. The horrible thing would happen that sometime our guys achieving results, patient and not to address trigger points is a big mistake. It will come back on the question of time. Yeah. It have to be adequately addressed. Fascia have to be released, muscles have to, trigger points have to be released. And then people feel a little bit better due to even not adequate treatment can help. Can help. Touch can help. Guys, I was involved in a lot of researches, and any solid research, we used to have control group against placebo. And let's say somebody diagnosed radiological means, spondylosis, and a lot of pain and objectives, and for 30 minutes somebody, this is control group, will hold like this, 30% will report results better, and the placebo is power that unknown to us. You see, this is what we have to, we have to convince them, and we have to provide adequate treatment. Otherwise, you help a little bit, and patient, all symptoms come, and patient saying, oh, I tried massage, and then I come back on Vicodin. It's work in the beginning. It's not what we're about, guys. We need minimum 70% of successful outcome. Successful outcome is sustainable results, and this is possible to do. We have to work. And this, if somebody teach you fast fix, ignore. There is no such thing. I, with authority, telling you, there is no such a thing. Fast fix. You can be very effective in one treatment even. But this is not what therapy about. Madam, right now I will need you on site. Then usually it's possible in this position, but her case, what I individually, I decide that I have to address neck, she will lay on side, please.
This way?
Mm-hmm. It doesn't matter, I will have to work you, this is real case. Yeah, pull this out. Yeah.
I got a question really quick.
Please.
Does that work on like real hairy areas as well?
Yeah. Lubrication. With no lubrication, even don't try. No, really. It's even don't try on anyone. With no lubrication, you can put only if you're leaving it to bruise. Yeah. Otherwise, yeah, absolutely working great. Mm-hmm. Guys, now I will do a little bit. For a second I will have to stay like this. It's okay with you? You know what? Little bit introductory. Yeah. Mainly in this case, Petrusage number 1, number 2, and you see it's a real. I will do introduction and I flush it differently. I will not use caps because maybe it will be bruised. And I don't. I will do with hands. From neck, from back, she will be bruised. It's okay. Here, that's nice. Although some with me, I said you can be bruised, okay? If the plant. How happened? Again, I'm bored. I'm on fire.
You are on fire.
I'm on fire.
No, this is actually not the best clip, so.
And
you're getting excited.
Doesn't matter. I will reshoot for you if you will need. If you will need, we will bring somebody. We will do all from the beginning, and we will invite this model. She's a good model. Yeah, here I need inhibitory regime a little bit more, guys, because it's sensitive. You see a little bit of pressing, muscles start jumping. It's probably old story. This is not from today. Sometimes headaches or no?
Yes.
Yeah. Guys, here, greater occipital nerve coming out and inserting, continuing the subcutaneous. Big percentage of tension headaches is the accumulation in muscular syndrome, accumulation of tension with the muscles, compression of greater occipital nerve, and this called neuralgia and nerve pain. And many times I see these cases, it's confused, misdiagnosed with migraine. Nothing to do with migraine. This is just tension headaches. Yeah, it is very, and yeah, I have no choice. I have to spend a little bit more kneading. Any pain here? No? I will go and you will tell me where. Here, it's sensitive, supposed to. Yeah, muscles jumping. See, I will, okay. We will go for fascia release. Because of lubrication, and like I stated, I again will have to go like this to say, I will grab a towel, and I improvising in a frame of Elizabeth Duclair protocols, I'm pulling, just grabbing and pulling to the different sides, connective tissue to release. It's all, you know what, guys, tension within fascia, like my model got, it's not overnight. Fascia accumulating gradually due to tension, due to metabolic disturbances, yeah? The greater snooze, the moment when you're successfully cleaning up tension with the fascia, if it will reaccumulate, it takes forever. It's a long process. It has to be real metabolism disturbed, insufficiency of blood supply to connective tissue for a long time. It has to be in order to fascia to accumulate these tensions, yeah. Look, if I will have her as a patient, this is other example after, God forbid, whiplash, car accident. Yeah, I would address on side. It's possible to do all what I did, but it was a little bit too much. And considering my mathematics is simple, she's very young, limitation of motion you saw was pretty significant. Yeah. In whiplash, thank God she knows, you also guys have to address all this laterally, including latissimus dorsi. Introductory. It's a must. Introductory, mainly kneading, gradually increasing pressure, kneading. Here I always do perostal massage. I go bone to bone. It could be a little bit painful, but actually I'm doing something very good for her right now.
But you're not applying a lot of pressure, right?
No, try not. I'm applying, look, this is not a big muscle mass, but I'm staying not to activate pain analyzing system. When I feel I press and muscles start protecting, go back immediately. No. Besides, when you go already reached naked bone, I call periosteum. Why to press? I just will stimulate. I will evade controllable inflammation. It's also important. Perostal massage, whole idea, additionally to eliminate trigger point periosteal, is to inflame. It's called controllable inflammation. The same idea plus minus like plurotherapy, regenerative therapy. It's awaking, what I'm doing, awaking migration of fibroblasts, spatial cells that depositing repairing material, elastin, collagen, and this is importance, additional importance to perform perostal massage. It's pretty tense here. Okie dokie, madam, another side, please. Oh, sorry. Yeah, also neck, exposed neck. Give me a neck. It will be like new, like a new. You will. If not, don't tell to no one. Guys, this is your judgment. When you feel like how to detect with hands, you know, fascia we're trying to push and this doesn't work, we know attention. This is local. With muscles, additionally to all what we client care telling us, and if we're compressing localized pain, it's also when you're compressing against muscles, they have to push back. Yeah, look here. You have to if you're pushing like against bone, there's a very tense muscle. Very tense muscles. Inhibitory regime, introductory, not to underestimate. It looks innocent, working, contributing a lot. It's allow you after this to go deeper, to mobilize little by little deeper layers. For example, layers like anterior scalene muscles to address. You have to inhibit tension, you can say. Probably sensitive, yeah? Mm-hmm. I'm sorry, a little bit. I will mobilize right now, fascia. Yeah, again, towel you're using when it's instead of to clean all, we don't have alcohol here in time, you can use towel. It's like you will grab, it will not jump out.
Is it possible to overdo it?
Yes. Yes, therefore, see, use your judgment, don't, intensive. You see, we cannot squeeze. Oh, solution, this is solution, you cannot overdo it. It will not move if this very tense. And besides, I teach step by step how to do. But look, if you, for example, with original Duclé method, I know once, many years ago, one lady lost consciousness. She was Olympian champion, gymnastic, and she lost consciousness. Sometime, when you're grabbing and fast moving, it can produce suddenly so intensive pain that knocking you out. And we were trained. Duclé, she prepared. She said it's possible, rare. I didn't know no one who said to me that it's happened. You know, and you're brave, you do what? It looks innocent. You're grabbing and moving. You saw how I performed, yeah? One lady I did treatment for her, gymnastics, she was Olympian champion. She said, oh, good, I will have massage a little bit, I will rest a little bit. I said, go, honey, rest. I say there. And I start, yeah. And then I got very unpleasant to do it. Not that I'm too sensitive. I also was Olympian athlete once, but I didn't like it. I started thinking with my head and substitute. I knew with no connective tissue massage, guys, you cannot. I thought, okay, here is the center. She asked like this, and she even, there is maps, direction how to perform on my website. You can find it also, Duclé. Yeah, I said, okay, in a frame, and our professor used to say, in a frame of established techniques or protocol, you can improvise. But it must be in frame to go with idea of these techniques. What I did, I took this, for example, this is the epidemical center, where is it? No, lubrication, no, this is so good. I grab, look, circle, you see fold of skin? And I pulling 1, 2, 3, 4. Then I changing direction of fold of skin. I come to my professor, I tried on a few guys, I come to my professor, I said, Professor, I don't feel comfortable anymore with this. He said, okay. I said, I proposed and I try. This is works, and show me. And I started showing. He approved. He approved it. This how, if this in frame of declare idea, all will work. In this case, less chance that you will overdo. Here you can knock somebody. Don't try to push. Be intensive, not aggressive. Guys, sense of touch I cannot teach. I can explain, I can help you with my answers, but sense of touch have to be developed. Yeah. Why I choose you as a model? I should do evaluation already. Move your neck. Move your neck. Good. You. Guys, chair, please. I need chair. Can you bring it to me? And right now we will talk on overdo. This is a good example to understand overdo. I will do traction.
Can you just demonstrate that technique again for me?
Yes. Eric, you can ask anything.
And you're getting a lot of hyperemia there too, again.
Pardon me?
You're getting a lot of hyperemia
Yeah. When good. He paid attention. Guys, periosteal massage, when you go bone to bone, there's also evidence of immediate effect. You see, immediate. You just take knuckle and you go bone against bone. Ooh. A little bit painful, yes? I will not do anymore. A little bit. 1, 2, 3, 4. It's not my fault.
How painful is that?
Pardon me?
Just for your model.
Not too. It's just uncomfortable.
I try not to. Guys, look, it's painful, and I know. If she will start or saying like this, or constricting, no, I will feel muscles start jumping, I will stop. Look, Professor Prilutsky, here the first one who proposed to us, thanks to this formula, about how much pressure. When I start school, many years ago, they say to me, on sacroiliac joint, press 20 kilogram. Nonsense. We used to ask, Professor, how, all our teachers, they said something I have to be reading in textbook. We wrote, ignore it. And you see it now, fresh trauma, all very sensitive. You see threshold very low, you will start pressing 20 kilograms and somebody will get in cramp. Protective node spasm. Yeah. Therefore, he proposed in, I believe, in 70s. Yeah, in the beginning of 70s, he said like this: pressure should be significant, but not to activate pain analyzing system. You see, if in the beginning, before introductory. And what does it mean to activate pain analyzing system? If she is subjective, will tell Boris, it's too much. I have to back up. I cannot judge that she is oversensitive because muscles is good, not protecting. I cannot. It just cannot. Her report that this is too much. It's rules, reading, and so on for me to go a little bit less. The matter of fact that you start in threshold very low and you're barely touching, it's already protecting you. With time, you're working in a frame of minutes. Threshold increase and you can do stronger and stronger. This is what you will have to adjust and operate with this. Yeah. Buy my DVDs there, guys. You will there all explain, and 50 protocols I'm presenting in this manner. Now, madam, I need you to lay on your back. Guys.
You work with your cup right along this line here. First of all, do you use a cup? And second, which size would you use?
Oh, accordingly, look on me, look at me, and look at her. You see, I'm bigger twice. Then no, on her I would use this one. This or this, it depends. If you can stick in, take it. But look, yeah, because if look, I'm big, probably I can afford this. Her size much. This is your judgment, guys. This is a lot. Your judgment. I can teach you general stuff. Yeah. And by the way, on DVD I explaining step by step. I explaining how to use and how to do it. Guys, the traction is extremely important. How this I can, a little bit. How we maybe even pillow. Yeah, I'm up. Yeah, like this. It's better. Look at my elbows, guys. This on table. I grabbed approximately on level C4, C5. Now I make sure that right now by flexing its elbows on table, by flexing my forearm, I will start traction little bit. And where is my friend? She asked about little bit. Yeah, a little bit. Yeah. Look, right now I'm a little bit, and I even don't want to know and not concerned that I activating penalizing system. Actually, I'm concerned, but in this case, I saved a little bit, and I hold 10 seconds, and then I will release. And then again, I will come to this point. I see how she's reacting. I will hold 10 seconds, and I will not release. You see, I'm releasing traction. You can see it's go back. I will minimum will apply traction, will allow to adopt this during 10 seconds, and then I will continue a little bit more from this position, not releasing. I reach this first stage, I will hold, and then I will flex a little bit elbows more, and will, yeah. No, traction parallel, direction parallel to floor. Guys, don't try here. It's look. Here I positioned. I hold and I position her traction. Yeah. Yeah, flexion of my forearms, guys. Not to try with body. It's have to. This way, you placing elbows on. Oh, I'm sorry. Forgive me. I'm placing elbows on table and only flexing elbow. Bending flex. This is the effort. I hold 10 seconds, then I a little bit more, usually 3 stages. And then it will take 30 seconds, 20 seconds. This is very important traction, but very, very gradually applied here. Scaling I would address. If this whiplash, scaling you have to, it's not comfortable, so let me, yeah, comfortable. Yeah, scaling I would address because when this whiplash, I believe so that anterior scalene muscles is the first in line to be strained. And why? Scaling, not all textbooks supporting it, but we know as a matter of fact, participating in inhalation. Lifting ribcage, scalene, so hard working muscles. Now, if this whiplash happened when one inhaling, whoa, a lot of force, because it's shortening, yeah? Even when one start exhalation, it's straining, it's ready to be forcible pulled, strained. You see, too. It's kind of lose-lose situation. Scalene, it's easy to address. You have to, this is deep muscle, under sternocleidomastoid muscle, you have to shift it first. To shift, now I compressing, I am against scalene, and of course with lubrication, now if you want to shift with one hand and with the other to massage like this, you also can. You can improvise. What is important is to shift. Now something important, very important. Most of trigger points within scalene, it's typical, I don't want to say most, typical, is a motor trigger point, where is the junction of muscles in nerve. Now I found, and trigger points have to be eliminated, otherwise it never will drop tension. Never. It will accumulate, maybe you will achieve some, yeah. When you find trigger point, Yeah, and she have to work with you. It's here, no, a little bit like this. You have to find angle of compression, most uncomfortable sensation causing, and you ask her, how this? It's worse. Yeah, this is the worst. Okay, don't start compressing. Never on scalene, don't, otherwise you will injure brachial plexus. I once participated in studies was stopped because constant kind of high percentage of injury to brachial plexus, we traumatize it. You holding like this, you must ask your client to turn to the same side. What happened with scalene right now? Cushion, it became wider, and now you can compress and you're protecting brachial plexus because brachial plexus passing under scalene immediately. Yeah, and then you again, first threshold of trigger point, you go to the first. She's determined when it is. She said to me, enough. I hold for 10 seconds. During 10 seconds, threshold increased. You can even double in some cases. You go slowly, more, and then you holding additional 20 seconds, and you fast withdrawal. And this is the genius, simple trigger point therapy. Actually, it's called ischemic. Basically, is ischemic compression. What happened when you compressed trigger point, first threshold? You practically obstructing blood supply. Now, what is the morphology of trigger point? Demand of blood supply much higher than availability. This is why this screaming with pain and do not allow two muscles to get to the normal resting tone. But what Boris is doing right now, it's already not enough blood supply. I'm obstructing blood supply. Yeah? Oh my God. 10 seconds, I'm obstructing. Continue to pump. Right now, some pool of blood around me. Yeah? Then after 10 seconds, reaching first threshold, I go more, I'm reaching second threshold. She said, enough. What I did, I totally stopped blood supply. Total obstructed. Now, vasomotor centers hate it. Whoa. They worry. It's enough few seconds. They worry. They're giving orders to these vessels under my finger. Dilate. Give more blood. Emergency. Yeah? Yeah. And heart pumping blood. And right now, bigger lake of blood. When I fast withdraw, compromised blood supply, vessels dilated, ready to accept. What I did, I addressed for this pain and formation of trigger point. Yeah, but scalene, remember, it's must. You find trigger point, then you asking them to turn, and then you start compression. Don't compress, never. This I want you to see and to consider. Now, sweetheart, what we will do, we will cover you, and this I will move. It's okay, yeah? Yeah, hold. I will hold here, not exposed. Tago party right now, you see, our play. But, no, but right now you just in continuation, bend your knees. Guys, like I stated, Whiplash, the first, if you will even try, this will be not forcible movement again, like this, and back a little bit, you will see it's contracting, protecting abdomen. Why, after addressing the most painful spots and waiting that others part will come out and will scream with pain, I always addressing abdominals. It's extremely important. This fear and physical effect. 35% of heart output goes to abdominals. 35% of all amount of blood that's supplied to entire body supplied to abdominal cavity. Now, this emotional and physical stress immediately obstructing arterial blood flow under pressure. But venous blood drainage, it's not under pressure. And when stasis or stagnation of venous blood happened, yeah, arterial blood, there is no room for arterial blood. Significant decreased amount of blood. It's give bad sensation, bending a little bit, posture changing. Yeah, these have to be eliminated. And therefore, as a preventive, or no, it's therapeutic effort and preventive effort, and kind of condition to succeed with severe whiplash type injuries, abdominal massage must be performed. Yeah. One rules, reading on stones, it have to be performed clockwise, not opposite, otherwise you will disturb. And look, usually you have to do this with both hands. You see, one hand doing full circle, and one will take a little bit more. And one hand following here. And little by little gradually increasing pressure. What happens right now is significant. I'm pushing out the blood like this. As you're seeing my hands moving, I accelerate, and it's so intense. So intense. And gradually squeezing more. And there's approximately 5 minutes. I will do drainage. Then we're placing 3 fingers usually. I will make it more. 3 fingers in the belly area. You're applying initial pressure and slowly, like screw type of movement, each following movement is larger, and you're covering all. And then when you reach the bigger circle, all, you start moving. Yeah, let's put it under. Yeah, absolutely. Okay, guys. We'll start from the beginning. I want you to feel. Yeah, and she needs this treatment also. Now, look, you start approximately 5 minutes like this. What is it, Starboard? This is... Nah, I don't want her. If she will tell me, I will. I don't care. I will not lose conscious. This is okay. Yeah, okay, from the beginning. Again.
Oh, it's going back again.
Yeah, now what can I do this?
Yeah.
Take it off. Oh, I saw she's another one. Take it away. Who need it? Gradually increasing pressure. Try to, to level with bending knees and good what I'm doing for you. Guys, it's a huge difference how she in general feel. Right now, what I'm doing, I eliminating a lot of. And then you hiding 2 times like this, it's creating, you can see it's creating like instrument, contact area, yeah, and on both sides of belly. Practically addressing right now under different angles all abdominal muscles. Yeah, it's also, guys, it's, you know what, a lot of us, a lot of people call it talking on corks. I don't know from what perspective to look at this as a cork. but abdominal visceral massage, impossible to overestimate. It's a lot, you know what, and due to stress disturbing significant drainage, causing this stagnation of venous blood. This is inflammation. It's decreased significant. Do not allow the quantities of this accumulation of this venous blood. Do not allow arterial blood. Arterial blood will be all put there, but there is no room. There have to be room. Look, yeah. What mechanical factor massage? Lotion here. Yeah. Look what happened. You look. Sorry. This is the mechanical factor. Yeah. What I'm doing right now, I'm pushing, accelerating venous blood drainage only towards the heart. We know how. Now let's say. Now this movement accelerate push mechanically 100 cc of venous blood. Just an example. It cannot be empty. We're making room for arterial blood supply. You see, and right now I'm intensively will push through. This way people immediately feeling the effect of massage. It's many positive changes, but one of them, this local increase of blood supply. An explanation that we're increasing blood supply is acceleration of drainage of venous blood. We're making room, and right now to the deeper veins. I will go. You see, with abdominal cavity, it's more important even, because 35% of all blood, it's there. You see, when it's decreasing blood supply, all this Crohn's disease, gastritis, what is it? It is in inflammation, gastritis. What is inflammation? It's active defense, not enough blood supply coming. Body triggering inflammatory conditions, increasing temperature and etc. The moment when compromised blood supply restored, it's extremely important in general. In cases of whiplash, the sudden, it's all disturbed so much, venous blood drainage, address it, you will not be able to progress. Look, like I stated at the beginning, somebody got multiple injuries, yes? But will report pain in neck. Because neck could be preconditioned, tension with the muscles and fascia could be precondition, and here is force, significant sprain and strain. If this sprain was so forcible that it affected ligaments even, yeah, of course patient will report mainly here. But significant pain could be in the lower back too. But because of intensity higher in upper back and neck, intensity of pain, patient will tell, I feel here discomfort. The moment when you addressed causes that producing pain is the tension with the muscles. You restore blood supply, you address trigger point. From 0 to 10 it go to 5, for example. And here lower back will be, just example, will be from 0 to 8. They will start complaining and they will tell you, you know, my pain moved. Pain did move. It was there. It was injured. And this is what you have to explain, to tell, expect. Yeah? But look, we're hunting because this multiple anatomical component were injured with this whiplash, you know, and it depends also force and angle how you will be hit. Yeah? We will hunt little by little and we will incorporate stress management. Yeah? This, if will be not restored, drainage of venous blood, it can be barrier to sustained results with this whiplash, with these headaches even. Yeah. Stomach venous blood stasis can cause significant headaches. Additional to greater occipital neuralgia due to trauma. Yeah. This, guys, don't exclude it. This, again, in the beginning I said, I was trained from textbook, but I'm teaching and sharing my experience from treatment room. Textbook giving kind of base. It's a little bit different in field. It's different because of individual approach. needs, our judgment in treatment room. But the experience, and again, in sports, professional sports, Olympian sports, it's pretty often this type of injuries. And first 20 years, I saw a lot of these cases. And little by little, you learn from others, you're coming to your conclusions. Do this. Madam, now I need you to go to dress, or maybe we'll give you bed sheet to cover you. Ah, yeah, you trained yesterday. Yeah.
How do you feel? Okay. Yeah?
Not yet. Eric, I have to finish with her. Treatment. It's good? Toga! Okay. Sweetheart, now you have to sit. Have a sit a little bit. Yeah, relax a little bit. And let's move to the right, all the way. Whoa, give me a hand. I was challenged. You see what I did? I tried to do the stretching. I will do it. Wow. You know what is it? To achieve results like this? Oh my God.
Amazing.
Amazing. I'm laughing. Yeah, let's go. But you need more treatments. You need. No, guys, to sustain. Look, with fascia, what is great news? A little bit go. Inhale. And exhale slowly. Like this. And again, inhale. And move slowly. Practically full.
The exhale to relax the.
Full. Yeah. It's good. It's helping with exhalation. Stretching is helping. It's not. Look, I don't want to tell you that your stretching will be not effective. If not, but this is better. You're dropping. You can do. Listen, I did good job, guys. You see, it was a challenge. It was a challenge. Yeah, but look, I will need you. You probably run and dress, and I will repeat a summary. 50 words are not promising, but I will do this short.
I'd like to thank Boris Prilutsky for this great demonstration utilizing Russian medical massage in the treatment of whiplash. Before we close up, we'd like to thank our sponsors. Thank you to our global sponsor, Massage Envy. Massage Envy's professional working environment was designed to meet the needs of their massage therapists, from spacious rooms to high-quality equipment and supplies. Visit www.massageenvycareers.com to learn why more than 20,000 therapists call Massage Envy home. Thank you to our education partner, ABMP. Associated Bodywork and Massage Professionals provides an extensive array of member benefits and exceptional liability insurance. Visit www.abmp.com to discover why over 80,000 massage and bodywork professionals have chosen ABMP as their professional association. And thanks to our daily sponsors, Massage and Bodywork Magazine, Massage Today, BioFreeze, Bon Vital, and Massage Warehouse.